13 medications that can damage your kidneys and how to prevent kidney disease. Did you know that the medications and supplements you take are processed by your kidneys? About 20% of cases of acute kidney failure result from medication use. This happens because kidneys play a crucial role in expelling toxins and waste from the blood. They filter blood, removing excess fluids to form urine. The kidneys also balance electrolytes and produce essential hormones for regulating blood pressure, bone health, and blood formation. If kidneys are damaged by toxins, they may not function properly. Therefore, it's vital to know the effects of medications on kidney health. Some medications can negatively affect the kidneys, even if renal function tests, like creatinine, are normal and you have no symptoms. If the kidneys are already compromised, these medications can worsen the condition, potentially leading to chronic kidney failure and the need for treatments like dialysis or kidney transplantation. What are the risk factors for medication-induced kidney damage? Be careful if you have pre-existing kidney failure, age over 60, dehydration, diarrhea or diuretic use, diabetes, hypertension, heart failure, infections, obesity, which increases the risk of kidney problems, high cholesterol, excessive alcohol consumption, which harms the liver and kidneys. Even without these risk factors, kidneys can still be affected by medications. 13 medications that can damage your kidneys and how to prevent kidney disease. The last one causes the most kidney problems in practice, so stay till the end. Number 1. Psychiatric medications. Using lithium for bipolar disorder can increase the risk of kidney complications. High lithium levels in the blood are particularly concerning, as they can cause kidney damage. Additionally, atypical antipsychotics like quetiapine, olanzapine, and risperidone, especially in elderly patients, can double the risk of hospitalization due to acute kidney injury. However, it's crucial not to stop these medications without medical advice. If you're taking these drugs, it's important to discuss with your doctor. If prescribed, your doctor has considered the benefits outweigh the risks to your health. Number 2. Antibiotics. Various types of antibiotics can affect the kidneys in different ways. Aminoglycosides like neomycin, the most toxic, followed by gentamicin and amikacin, are examples. Sulfas, found in Bactrim, can form insoluble crystals blocking urinary flow. Vancomycin can cause swelling and inflammation in the kidneys, potentially leading to kidney failure. Additionally, quinolones like ciprofloxacin can cause interstitial nephritis. Remember, in patients with kidney problems, the dosage of certain antibiotics must be adjusted to avoid additional kidney damage. Number 3. Herbal supplements. Herbal supplements are a type of dietary supplement with therapeutic properties, available in various forms like tablets, capsules, powders, teas, extracts, and as fresh or dried plants. They're popular for their perceived health benefits, but unlike conventional medicines, herbal supplements aren't subject to the same rigorous safety and efficacy tests, making them potentially dangerous. A 2007 study identified over 15 herbs and supplements that caused kidney problems. Examples include chromium, creatine, licorice, willow bark, vitamin C, and yohimbine. Note that, even if natural, these supplements aren't necessarily safe. Some can negatively interact with prescribed medications, act as diuretics, or adversely affect the kidneys. Many contain potassium and phosphorus, elements that may need to be controlled in people with kidney disease. People with kidney disease are advised to avoid using herbal supplements without consulting a doctor or pharmacist. Some herbal supplements to avoid for these patients include astragalus, apium graveolens, horsetail, licorice root, parsley root, bearberry, barberry, creatine, huperzine, nettle, pennyroyal, yohimbine, cat's claw, goldenrod, Java tea leaf, Oregon grapefruit, and Ruta graveolens. Number 4. Laxatives. Generally, laxatives are safe for most people. However, dehydration from laxative use can harm the kidneys. Particularly, laxatives prescribed for bowel prep before procedures like colonoscopy, such as sodium phosphate, can be harmful to the kidneys. It's crucial to stay well hydrated when using laxatives to minimize risk. Also, it's important to use laxatives under medical guidance, especially in individuals with pre-existing health conditions or undergoing treatment for other diseases. Prolonged and frequent use of laxatives can also lead to electrolyte imbalance, harmful to the kidneys and overall health. Therefore, always consult a doctor before starting a laxative treatment, especially if there's a history of kidney issues or other sensitive medical conditions. Number 5. Antivirals. If you've been diagnosed with herpes simplex or shingles, you might have been prescribed acyclovir or valacyclovir. Be aware that these drugs can cause swelling and inflammation in the kidneys and can also form undissolvable crystals. The same caution applies to antiretrovirals used in HIV treatment like tenofovir and indinavir, which can damage renal tubule cells. Thus, when using these medications, ensuring adequate hydration is essential. Number 6. Zoledronic acid. Zoledronic acid, commercially known as Reclast, is a member of the bisphosphonate class of drugs, mainly used for treating osteoporosis. A rare but serious side effect associated with zoledronic acid is kidney injury. The FDA, US Food and Drug Administration, issued a formal warning about this risk. Generally, Reclast is not recommended for people with compromised kidney function or pre-existing kidney damage. The same caution applies to Zometa, another formulation of zoledronic acid, used specifically to treat high blood calcium levels, a condition that can occur in some cancer types. Number 7. Medications for gastritis and heartburn. A study published in JAMA in 2016 revealed a potential connection between prolonged use of proton pump inhibitors like omeprazole, lansoprazole, and esomeprazole, and an increased risk of kidney damage. The study indicated that individuals taking these medications chronically have a 20% to 50% higher risk of developing chronic kidney disease compared to those not using these substances. While a direct cause and effect relationship isn't established, it was observed that the higher the drug dosage, the greater the risk of kidney problems. Number 8. Iron supplements. Iron supplements are often prescribed to treat anemia caused by iron deficiency and, when used according to medical advice, are generally safe. However, excessive use of these supplements can lead to iron overload. This condition can cause iron to accumulate in the kidneys, resulting in iron toxicity, and, if not properly treated, can progress to kidney failure. Number 9. Blood pressure medications like inhibitors. There are two groups of medications. One side includes captopril, enalapril, and ramipril. On the other, losartan, valsartan, and olmesartan. These medications can have both positive and negative effects on the kidneys. They work by dilating the efferent artery, which can be beneficial in cases of heart failure, hypertension, or diabetes, helping to preserve kidney function and slow down kidney function loss. However, in situations of severe dehydration or advanced kidney failure, the same medications that protect the kidneys can accelerate the need for dialysis and increase blood potassium levels. Therefore, in cases of severely compromised kidney function, doctors may choose to discontinue these medications. It's a situation similar to a balloonist who needs to discard a sandbag so the balloon can rise again. Number 10. Contrasts. Before undergoing a contrast CT scan, it's vital to ensure proper kidney function, as the iodinated contrast used can induce contrast nephropathy affecting kidney health. The same contrast is used in other diagnostic procedures like angiography, cardiac catheterization, and excretory urography, where iodine, though improving image visibility, can be nephrotoxic. In magnetic resonance, the contrast poses fewer risks, but can still be dangerous in cases of advanced kidney failure. Therefore, a prior kidney evaluation is essential to prevent complications and ensure patient safety in procedures using contrast. Number 11. Fibrates. Fibrates, like ciprofibrate, fenofibrate, and gemfibrozil, are often prescribed for treating high triglyceride levels. However, in patients with any level of kidney dysfunction, using these medications can worsen kidney damage. Therefore, it's recommended to avoid fibrates in these cases to prevent deterioration of kidney function. It's crucial to monitor kidney health in these patients and seek safer treatment alternatives to control triglyceride levels. Number 12. Diuretics. Cardiologists often prescribe diuretics as a fundamental part of treatment for patients with heart conditions. These medications are an essential tool in managing heart and blood circulation problems. particularly effective in controlling hypertension and heart failure. By reducing body fluid volume, diuretics decrease the workload on the heart and pressure in the arteries, significantly contributing to improved cardiovascular health. Additionally, diuretics function to eliminate excess fluid from the body, increasing the amount of salt and water excreted in urine. This helps reduce swelling and fluid buildup, common in patients with heart failure, providing symptom relief and improving cardiac function. However, diuretic use can also lead to side effects like dehydration. This occurs due to excessive fluid excretion, resulting in the loss of water and essential electrolytes, a particularly relevant concern in elderly patients or those with other medical conditions. Among the most commonly prescribed diuretics are furosemide, Lasix, known for its potency and quick action, hydrochlorothiazide, often used for hypertension, and indapamide and chlorthalidone, both used in controlling blood pressure and specific heart conditions. Each of these medications has its own action profile and side effects, chosen based on individual patient needs and specific treatment goals. Number 13. Anti-inflammatories. When it comes to medications that harm the kidneys, anti-inflammatories often come to mind. And this association is correct. Medications like ibuprofen, naproxen, and diclofenac are frequently cited for causing kidney damage due to their widespread use. Many people use these drugs for joint pain, menstrual pain, or muscle pain. While effective for pain relief, anti-inflammatories can reduce blood flow to the kidneys, leading to kidney failure and interstitial nephritis. The danger is even greater for those already suffering from kidney problems. In these cases, the use of anti-inflammatories can trigger acute renal failure, requiring even emergency dialysis. The risk increases after 3 days of continuous use, and prolonged consumption at high doses can cause similar damage. Fortunately, kidney disease caused by anti-inflammatories can be prevented with careful use and medical guidance. A common question: my doctor recommended aspirin. Can it cause kidney problems? Does it harm my kidneys? At the preventive dosage, ranging between 81 and 200 milligrams, aspirin generally poses no risks, even with prolonged use or in cases of reduced kidney function. However, excessive aspirin consumption, especially doses of 500 milligrams taken repeatedly over several days or weeks, can not only cause ulcers, but also damage the kidneys. What pain relievers are safe for people with kidney problems? Paracetamol and dipyrone are common choices for pain relief. If an anti-inflammatory is needed, corticosteroids can be an alternative, although they also have their own risks. The use of corticosteroids can be associated with various health complications, including the development of osteoporosis, raised blood sugar levels, and the emergence of cataracts. Therefore, it's important to weigh the benefits and potential risks before starting a corticosteroid treatment. Important: just because a drug is not on this list doesn't mean it doesn't harm your kidneys. There are medications used in chemotherapy and anti-rejection drugs for transplants, as well as various types of supplements that can have varied impacts on health. These categories of medications are essential in specific treatments, like fighting cancer or post-transplant. But it's important to be aware of possible side effects and monitor overall health, especially kidney function, during the use of these medications. How to avoid kidney injury? It's crucial not to take medications or supplements without a prescription. Some supplements like chromium, yohimbine, and creatine can be harmful to the kidneys, especially if there's already a kidney problem. Therefore, caution is important. Stay well hydrated, drinking enough fluids to help your kidneys eliminate toxins. Dehydration is a risk factor for kidney failure, as it can result in a higher concentration of the medication in the body and prolong its presence in the system. Avoid alcohol consumption while taking medications. Alcohol can lead to dehydration, increase blood pressure, and heighten the risk of kidney problems. If you suffer from hypertension, it's crucial to keep blood pressure under control, as both high and very low pressure can damage the kidneys. Similarly, if you have diabetes, controlling blood sugar is essential to prevent kidney complications. If you already have kidney problems, visit your nephrologist regularly. Remember also that people with kidney problems should avoid starfruit. Both the juice and the fruit contain caramboxin, a neurotoxic substance for those who can't excrete it properly through the kidneys. Caramboxin poisoning can cause vomiting, uncontrollable hiccups, weakness, agitation, seizures, and even death. Therefore, it's important to avoid starfruit if you have kidney problems. Liked the video? Learned about the medications that harm the kidneys? Remember to share so more people can have this knowledge. Thank you for watching. Don't forget to subscribe to the channel. See you in the next video.